my topic of presentation is substance use disorder among adolescents before and during the COVID-19 pandemic in Uganda. So I'm going to take you through the background why we decided to do this topic. So that's the university. Adolescence, this is a period of transitioning from childhood to adulthood. And according to World Health Organization, this is the period between 10 years to 19 years of age. And during this period, there are a lot of changes happening in the neurodevelopmental changes happening, which are highly influenced by the social, cultural, and nutritional influences. And as these neurodevelopmental changes are happening, they can give rise to characteristic behaviors during the adolescence period, such as improvement in their cognition, executive functioning, increase in reward sensitivity, risk-taking behaviors, and also spending more time with their peers. So in turn, these characteristic changes can give rise to, they can contribute to initiation of substance use. So substance use remains a significant public health concern, and research found out that 50% of substance use initiation starts during adolescent period, and in sub-Saharan Africa has the highest population of adolescents with an estimated... I didn't know I was tall enough. Okay. Okay, let me just put down the... Okay, is that okay? Okay. Okay. Is that okay? Is that fair, right? Okay, so sub-Saharan Africa has the highest population of adolescents, and estimated prevalence of substance use was about 41.6%. And a study done in Uganda in school-going adolescents showed a prevalence of substance use about 60 to 71% in school-going adolescents. They had already started using addictive substances. So during COVID-19 pandemic, it was reported that substance use and substance use disorder had increased, maybe due to associated factors like restriction in movement and then social isolation. So the social and economic restrictions during COVID-19 pandemic, they reduced regulation of stress, anxiety, and then existing mental health conditions among adolescents, because interacting with their peers kind of helps them to reduce stress, anxiety, and also to cope with different stresses of life. And then they were also predisposed to domestic violence, childhood maltreatment, traumatic experiences, all these paving a way to substance use among adolescent victims as a coping mechanism. So we aim to determine the prevalence of substance use. Oh, sorry. I'm going ahead of myself. Okay, so we aimed to determine the prevalence of substance use disorder before and during the COVID-19 pandemic. We did a retrospective review of outpatient files in Mbarara Regional Referral Hospital, which is one of the largest tertiary hospitals in southwestern Uganda. And we reviewed outpatient files. A total of 441 patient files were included in this analysis. Adolescents 10 to 19 years of age, and it was between November 2018 to July 2021, using March 2020 as a cutoff between pre-COVID and during COVID period. Ethical approval was sought, though informed consent from the patients was waived because we could not trace all the patients at that time. Then data was analyzed using Starter, chi-square tests, and logistic regression were used. So the results showed that there was, before COVID, it was 5.9% substance use disorders, and then during COVID-19, it was 9.8%. Though there was a slight increment of 3.9%, statistically, there was no significant increase because the p-value was greater than 0.05. It was 0.13%. So males were found to be more than females, of which males were 50.34%, and then the mean age we saw was 17%. And the odds of using substances, with every unit increase in age, the odds of using substances were 1.72. So, oh my God, so those are some of the substances that were being used. We noted an increase in cigarette smoking during COVID-19.